Hello and welcome to your program of choice, Health Affair on AIT. I am your regular anchor, Oshuomowa Daniels. On the program, we discuss critical health issues, challenges of women and children, with a view to finding lasting solutions. This week's edition is a special one. We shall be focusing on the nation's health sector at 61, the challenges and the way forward. Before that, let's take you through our news segment.
The World Health Organization (WHO) has prioritized access to diabetes and cancer treatments in its new essential medicine list. The model list of essential medicine, which was published on the 1st of October 2021, includes new treatments for various cancers. The list also has insulin analogs, new oral medicine for diabetes, new medicine to assist people who want to quit smoking, and new antimicrobials to treat serious bacterial and fungal infections. The listing equally aims at addressing global health priorities, identifying the medicines that provide the greatest benefits, and ensuring that they are available to all. The Director General WHO, who spoke about this recent development, noted that too many people who need insulin are financially incapacitated and find it difficult to purchase. He further explained that the inclusion of insulin analogs in the essential medicine list are vital steps in ensuring everyone who knows this life-saving product access it.
Beaming with smiles and surrounded by his heartthrob and children as he danced his way to the front row to assume the position of the 40th President, Ilupeju Lions Club, District 404, B2, Nigeria. Giving the international theme of the Lions Club, Service from the Heart, and that of the district governor, Service Our Way of Life, Oluwaseun Elijah Ayorinde is set to work around the major area of focus of Lions Club International, which includes vision, diabetes, childhood cancer, elimination of hunger, environmental protection, and youth empowerment. The event also provided an opportunity to raise funds for service projects with a specific focus on the diabetes clinic at the Lagos University Teaching Hospital, LASUT.
We being a service organization, what we have done over the years and we continue to do is to contribute our own quota. While the government is doing theirs, we also pull ourselves together and live the essence of our club by providing succor in all the areas, in ways or areas by which we can. We are doing an expanded or an expansion on the existing diabetes center or diabetes clinic at LASUT. And we trust that God will help us achieve this. We are doing this essentially for humanity's sake. And all we're doing is to see how we can provide a good environment, also increase the capacity of that structure to be able to accommodate more that actually needs it.
Our objective is basically to reach out to the underprivileged within our communities and worldwide. Having been in 206 countries of the world, we are touching lives in more positive ways. We have fought preventable blindness. We have tried to improve our environment. We have fought hunger through our hunger relief programs. So when the pandemic, the COVID-19 pandemic came in, it didn't catch us unaware. We were there in our various communities, especially during the lockdown, providing relief materials to our various communities. We were also there for the government, the NCDC, and provided relief. In fact, we got a grant from our international office to provide relief and essential materials for our local authorities. And in this regard, even local lions, right, donated to the federal government several hundreds of millions of naira, and also donated to Lagos State government in their bid to fight the pandemic.
Individuals who have supported the club in no small measure were also decorated.
The federal government on Wednesday, September 29, 2021, approved a 14-day paternity leave for fathers. This was disclosed by the head of service of the Federation, Dr. Folashade Yemi Eson, while briefing news reporters. She also added that the paternity leave is for men who work in the federal civil service. Some Nigerians who expressed their concerns over the issue urged the government to equally extend the same gesture to adoptive mothers. The Lagos State government has commenced the psychosocial support capacity building training program for frontline health workers involved in the state COVID-19 response as part of its efforts towards ensuring their well-being and emotional health. The program, which commenced on Thursday, 29 September 2021, is scheduled to hold in 2 batches from the 29th to 30th of September in the first batch and from the 4th to 5th October 2021 in the second batch. The Commissioner for Health, who spoke at the flag off of the workshop, said the capacity building program will help in providing support in managing stress and burnout associated with the response and ultimately improve psychological, emotional, and physical well-being of participants. He added that the program is scientifically and specifically designed to give insight into the causes of fatigue and mental health issues among health professionals, as well as collect data to inform further action. He noted that the first phase of the training will focus on the frontline workers at the Infectious Disease Hospital, Yaba, because theirs is an emergency. Oxygen is life, an essential gas that is important for the treatment of many common childhood conditions. The advent of COVID-19 and its challenges has reinforced the need for medical oxygen as a life-sustaining ingredient.
Everybody that needs oxygen, that our health system can detect the person, but is also able to provide them with the oxygen as at when they need it. And then to do that, we need the right kind of human resources with the training and also the equipment to be able to diagnose and administer medical oxygen at the right grade.
According to these experts, the availability of equipment to diagnose and administer medical oxygen on time will help reduce increasing mortality rates in the country. They therefore called for the quick implementation of policies that would fast-track oxygen system availability in Nigeria.
From a rapid assessment that was done in Oyo State, we actually see that we have 4 facilities across the state with a functional oxygen plant, which is actually very small for a state like Oyo State.
We need to ensure that while we're responding to the COVID-19 pandemic, we're also leveraging on the investments that we have for that to also strengthen our system.
The Ogun State government has reiterated its commitment to sustain the empowerment of women of reproductive age and families with the provision of quality family planning services to further increase the health indices of the state. The Commissioner for Health, Tomi Koka, who made this known in Abeokuta, said that the state is poised to provide affordable, qualitative, and efficient healthcare delivery for the people. He added that primary healthcare centers across the state had been renovated, equipped, and staffed to meet the daily health needs of people in various communities, assuring residents that women will not die as a result of pregnancy-related complications. The Executive Secretary, Primary Healthcare Development Board, Elijah Ogunshola, who added that the state had drawn a strategic plan to enhance family planning programming, noted that the support it received from the partner over the 4-year period would assist in improving the welfare of women.
Nigeria at 61 is confronted with numerous challenges in all sectors of the economy, and most disturbing of them all is the health sector. This is because health is the pivot upon which every other thing revolves. Though the resident doctors have suspended their strike that lasted for over 62 days, the issue of poor working conditions has remained unresolved. There is the challenge of disease burden and lots more. I spoke with a cross-section of experts on the Nigerian health situation and the way forward.
Nigeria healthcare at 61 Nigeria, we are not where we should be. In terms of personnel, in terms of manpower, they have adequate, but all the necessary practicing environment is not adequate, and it is still also part of what the doctors, especially in government, these are some of the things that they are fighting for. You see, when you know you can do something and you are not able to do it for one reason or the other, you are not practicing at your best, and people don't. Once those things happen, it's always a problem, because it's not only that you are depressed, you are also not bothered about what it is, because you know those things are not there. So government needs to be abreast of it. All these, even the government officials that go abroad for one thing or the other, it is simply because those equipments are not here. And unfortunately, by the time they travel abroad to go and seek medical treatment somewhere, they meet Nigerian doctors there. So what's the difference? The difference is just because of the practicing environment that is conducive over there than here. So government needs to look into that for us to begin to, have a better practicing environment.
Well, we have a long way to go, and that is why we still see a lot of things that are happening the way it's happening now. Access to health care is one of the things that should be prioritized in Nigeria. We should not just leave it to government. And at the same time, also, our medical personnel should sit up. There's so much break in service in Nigeria. We have a long way to go. We have over 30,000 primary health care facilities across the country. And if you look at the percentage of those that are functional there, it's still less than, let me even say, 10%. And that is not too good for us. Primary health care services is the bedrock of every health system. Without the primary health care facilities, there's no secondary, there's no tertiary. You overburden the secondary facilities, you overburden the tertiary facilities. Tertiary facilities should not be involved in taking care of basic primary care. And you still go to the likes of Luz, you go to National Hospital, and you still see them taking care of women that come for antenatal. These are things that should be done at the primary health care facilities. We need to develop it, and I think Nigeria needs to start thinking in that direction. That's the bedrock of a good health system.
We cannot say that we have fared very well, but we're still in the tooting and crawling stage. With the support of all the stakeholders, we're talking about the health workers, we're talking about the policy people, we're talking about the citizens who are the end users of the services that we're providing. We need to be apt and know what we want. On the government, on the part of the government, we need to look at a policy that suits our climate. Most of the time we import policies, we don't properly domesticate it to our own needs and our own culture, and this has been affecting us tremendously. One of the main challenges that we have when it comes to policy is, and it's a global thing, at the point of assessing service delivery, you find out that people don't have to, but largely in this country, we're still out of the pocket payments. And that's why we are talking about how health insurance, which has worked in other time, is also going to work in our environment. And you know the attitude of Nigerians to insurance generally. They do not believe so much on insurance, but we need to start changing. So there has to be a purposeful drive by the National Orientation Agency to do a lot of things to change the orientation, using the IT, using the social media to change the direction of the citizen towards accepting the need for health insurance, because at the point of need, that money may not be there. So we have to protect the citizen against this financial catastrophe that we are talking about, and giving them both equity and equality medical services. So we have to have a policy that is driven in that direction. Also, bloating the pool of the fund is very, very important. And the government started very well. The 1% consolidated revenue is being into the pool. But you find out that we need more than that. And the reason why we need more than that is that we need to also properly quantify what the cost of health services is. We've been having challenges that we do not have. We do not have the statistics. We do not have a properly costed actuarial value for health services. That we should also do, and that is how the policy will also work and bring into this. So on the aspect of the providers, they need support to properly fund that system, either by leasing or somehow where the government will come in. For we have shortage of staff. That is an established thing, and we are still seeing this migration, exodus of doctors going out. And when we're talking about service providers, we're not talking about doctors alone. As a matter of fact, more nurses are leaving the country than doctors. Okay, so we need to find a way to keep the little human resource for health for us, for the citizen, for the appropriate number of citizens that we have. We need to have a way of supporting people that have made up their mind that they need to start a private service delivery. They need to have a special health bank for them to fund their facility and have a quality system that are scalable to go up. On the aspect of the citizen, of course, I've said that the citizen should have a change of mind, that once they have health issues, first point of call must be a facility. But the facility must be available, must be accessible, and must be affordable. And that is the challenge that we are having. The government must have a raised concern that all these stakeholders, appropriate stakeholders, because most of the time when we are discussing health services, we do not have an appropriate people that are supposed to be discussing it. Most of the time, you take government people to discuss government issues without involving the private sector. And that is the challenge we are having. We are having a lot of foreign funded providers that are coming in. And they are coming in with a huge fund. They are obviously going to take away the client from the local investors. There's nothing wrong about that, but the truth about it is that we must have a policy that we engage even the local investors. Otherwise, because those people are not sustainable, and our home will be killed, and by the time they leave, we will now have nothing to have as an health provider. So these are the challenges that we have. If you look at all this, you can see that from 1960 to now, we've not been able to, we can't score beyond 20%.
If you look at Nigerian health sector as a whole, a lot of countries want to get Nigerian doctors. That's the truth. That says a lot about our training capacity. But for various reasons, Nigeria is unable to hold them. So it's once we are able to address those issues, whereby we can hold our talents, I know that Nigeria's healthcare system will get significantly better. So Nigerian doctors are good, just that it's the environment that may not be holding them.
So what is your advice about making the environment okay for them to stay?
Yes, it's like any employer. Make the work environment enjoyable. in terms of making sure that the tools for the work are available, ensuring that you encourage people and appropriate remunerations. And also it's in every organization. If an employer cannot meet those demands, most employees will leave. So whether government or private, it's the same thing. A decent work environment, appropriate work tools, and appropriate remuneration.
If you're just joining us, it's Health Affair on AIT. Next on the show is our nutrition segment.
Grape is a fruit and botanically a berry. Grapes can be eaten fresh as table grapes, or they can be used for making wine, jam, raisins, grape juice, and jelly. The seeds can be used for vinegar and grapeseed oil. Archaeological evidence suggests humans began growing grapes as early as 6,500 BC. The world produces about 7.2 trillion gallons of wine each year, making it by far the most prevalent use of grapes. This value represents a 35% increase since the mid-20th century. Europe, especially in Italy, France, Spain, and Russia, account for 80% of total world production. Fresh table grapes account for less than 12% of the world's total grape production. Since fresh grapes are highly perishable and transportation costs high, fresh grapes are consumed primarily in the country of their production. Grapes are classified into different varieties, such as native grapes, European grapes, French-American hybrids, and Muscadine grapes. Grapes are packed with nutrients, especially vitamin C and K. 1 cup, that is 151 grams of red or green grapes, contains 104 calories, 27.3 grams of carbohydrates, 1.1 grams of protein, 0.2 grams of fat, 1.4 grams of fiber, 27% of vitamin C, vitamin K, 28% of the recommended daily value, thiamine, 7% of the recommended daily value, riboflavin, 6% of the recommended daily value, vitamin B, 6%, potassium, 8%, copper, 10%, magnesium, 5%. High antioxidant contents of grapes help prevent chronic diseases.
On our clinical segment, we give you tips for healthy living. Be a part of the program by sending your views on how to improve human lives and the nation's health sector.
We have to use synergy to rid our country of merchants of death who are waging another kind of war through the backyard by giving people substandard, unwholesome, fake, spuriously labeled products to consume. That has serious health implications on our people. And the government is stretched with facilities and medical equipment that we have. But now, if you now have to increase the burden by giving people things that will make them go to the hospital and kill them, is a way to wipe off a whole people. So we have to see it as it is. It's a war. It's not is not just business, because some other people see it as business, but we see it as a war, and that we have to get the message across to our people not to take anything that they have not, that NAFDAC has not verified. Not, the fact that something is cheap does not mean that it is good. We have to shine your eyes, just like NAFDAC says. And you have to look at what you are buying. Check the expiry date. Apart from the expiry date, check is it from the accredited people who are supposed to sell. There are a whole lot of things to check. So you don't use your money to buy death.
No social distancing, no nothing. And ineffective use of face masks or non-use at all. So what do we expect? This is the result that we are seeing. Government is trying, but the truth of the matter is our own part of the bargain. We are not doing it. I'm not aware is whether it is Governor Sanwo-Olu or President Buhari that is going to wear face masks for everybody. Those are areas that we need to, and the press need to actually really, it is, look, people, they say that experience is the best teacher. But I can assure you that COVID-19 is better imagined than experience.
Be a part of the program by sending your views on how to improve human lives and the nation's health sector.
Or for us to plan for future, essentially for us to be able to move forward as a nation. Because everywhere, at the peak of the outbreak of COVID-19, there was restriction. And it's on record that restrictions as enunciated by governments of most countries were obeyed by citizens. So it calls to question why we as a people, as Nigerians, cannot obey such regulations, which is meant to protect us as a people from having high casualty from the spread of COVID-19. Why do we tend to believe what comes out from other countries and not believe what comes out from our own country? We as a people should search ourselves. I made an allusion to the fact that when we travel outside this shore of Nigeria, we obey the laws there. But the moment we land in our Muritala Mohammed International Airport, we flout all laws as a people. So it is something that is inherent in us as Nigerians that we must change. And that is why the National Orientation Agency came out with the charge that change begins with me. It doesn't matter where the change begins from, either from the top or from the bottom. The fact remains that every one of us as Nigerians must change.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please, let's do it again, same time next week. My name is Oshuomowa Daniels.